In this video, we will go over urge suppression techniques. If you haven't already done so, we strongly encourage you to first watch the pelvic floor strengthening video series, since the content in this video will build off that information. Let's begin by talking about what normal daily fluid intake is and urination timing. Generally, we recommend that you drink 6 to 8 glasses of water per day, with 8 ounces of water in each glass. But this can vary based on several things, such as your weight, temperature, activity level, and medical conditions. It can also be helpful to take sips of fluid throughout the day, instead of drinking large amounts of fluid at once. If you wake up more than once at night to urinate, it can be helpful to limit your fluid intake 2 to 3 hours before bedtime. Beverages with caffeine, carbonation, or alcohol should be limited. This is because they can irritate your bladder and lead to an increase in how often you urinate. Please speak to your primary care doctor for guidelines on how much water you should be drinking. The interval between trips to urinate should be once every 2 to 4 hours during the day, and no more than once per night. You should not make trips to the restroom unless you have a strong urge to urinate. This means do not use the restroom just in case. Going to the restroom more often does not mean that you will leak urine less. In fact, the opposite is often the case. Urinating more often can lead to urinary leakage. If you are drinking enough fluids throughout the day, it is normal to feel a first urge to urinate when your bladder is about half full. This first urge usually does not mean that your bladder is full, and it does not mean that it is time to use the bathroom. Urges come in waves that will pass. If you use the restroom with this first urge, it can lead to a need to urinate more often. If you find that you are going to the restroom to urinate more than once in 2 hours, we recommend training in what is called urge suppression. Urge suppression is a technique where the pelvic floor muscles can be used to reduce your urge to urinate. This technique trains your bladder to store more urine for a longer time, and with practice will eventually reduce the number of trips you take to the restroom. This ability to control the urge to urinate can also help with episodes of urinary leakage. And when your bladder learns how to store more urine during the day, this often leads to fewer wake-ups to urinate at night. Let's practice what to do if you are feeling an urge to urinate, even though you emptied your bladder less than 2 hours ago. First, do not rush to the toilet. Sit down if you are able. Take a few calm breaths. Breathing slowly will help calm your entire nervous system, including the nerves to your bladder. Next, breathe into your abdomen, allowing it to expand. Then, slowly breathe out as you tighten your pelvic floor muscles as strong as you can and hold for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now breathe in and relax. Engage the pelvic floor muscle just how we taught you in the previous video series. Repeat this breathing and pelvic floor tightening pattern 5 to 10 times. Strong pelvic floor muscle tightening sends a message to your bladder to relax the urge and allow the bladder to store urine for a longer period of time. Finally, distract yourself. Continue calm breathing and let the urge pass with positive thoughts. Once the urge has passed, you can continue with your normal activities. It can be helpful to keep a bladder diary for a few days in a row, keeping track of your total fluid intake and the times that you urinate between each 24-hour period. There are many free online bladder diary templates and even phone apps for bladder tracking. Once you discover your usual urination times, you can increase the time between urination episodes by using the urge suppression technique. Try starting by using this technique to extend the time to your next urination by 15 minutes, and then gradually increase the time by another 15 minutes per week, with the eventual goal of extending your usual urination time to more than 2 hours. Use a timer on your watch or phone to help remember how long it has been since your last trip to the bathroom. Repeat the urge suppression steps to calm your bladder as needed between urination times. Practice these urge suppression techniques on your own for a few weeks. If you continue to struggle with urinating too often or continue to experience urinary leakage, please talk with your physician about a referral to pelvic floor physical therapy so that we can provide you with more individualized instruction and exercises.